Okay, today we will be talking about preparation for patient care. This is on chapter 13, which starts on page 270 of your dental assisting textbook. In this chapter, we'll explain how the patient record is developed and the importance of the personal registration form, the medical and dental information, clinical evaluation, and the extraoral and intraoral examinations. We'll learn how to perform or assist the dentist in an extraoral and intraoral evaluation, including lips, tongue, glands, and oral cavity. We'll explain how a diagnosis and treatment plan is developed. We'll learn how to perform vital signs on the patient, including both oral and tympanic temperature, the pulse, the respiration, and blood pressure. We'll document the vital signs and be alert to any signs that are abnormal. And we'll identify the 5 carotid cuff sounds, which are the 2 sounds that are used in recording blood pressure. For effective treatment to take place, dental assistants must get a complete and accurate patient history. This includes personal information such as name, address, phone numbers, emergency contacts, social security number, and insurance information. A medical history is also obtained, including information on past surgeries, diseases and injuries, allergies, and current medications used. Dental information is also obtained, such as a patient concern or any patient concerns and the date of the last exam. Clinical observation is then done to determine deviations from normal, such as a patient's gait, which is the way they walk. Facial symmetry is the face symmetrical on both sides, and the condition of the patient's skin and eyes. Personal information, like I said, includes the names and address. It could mean their social security number for financial reasons, insurance information, a physician's name, and an emergency contact. Personal information is related to an individual's background. It includes those items that identify the patient and allow the practice to contact the patient or any people the patient designates the practice to contact if there's an emergency. It also includes patient's insurance information for billing purposes. Medical information relates to anything the patient is experiencing physically or mentally that impacts a patient's overall health status. It includes past surgeries such as gallbladder removal or heart valve replacement, systemic diseases such as hypertension and diabetes, allergies such as medication or latex, and injuries such as back injuries or broken bones. Dental information is related to the patient's oral health and the reasons for the patient's visit to the practice. This includes the patient's attitude towards dentistry and quality of previous care of the oral cavity and teeth. Clinical observations relate to any deviations from normal that the dental assistant may note while speaking to and observing the interactions he or she is having with the patient. This can include the gait, which is the way the patient is walking, speech, if they're having any type of speech problems or issues with speaking, any behavioral issues, their eyes, whether or not they're dilated, I'm talking about their pupils, and then facial symmetry. We want to watch for any signs of stroke or anything like that. If any side of their face is drooping, such as their eyelids, we will want to note that in their records. Once the patient is brought back to the operatory and is in the clinical setting, we will finish any consent forms if they need to be signed, referral information if necessary, and if that patient is due for radiographs or x-rays, we will take those as well. The clinical examination includes the mouth and lips. So we look at whether or not there is cracking or ulceration. We look at their smile line, the vermilion border, which is the border between their lips and their face, commissures of the lips or the mouth, which is the corners of their mouth, the external floor of the mouth, and their lymph nodes. The dental assistant or dentist will perform a clinical evaluation of the patient. This consists of checking the condition of the patient's mouth, lips, and floor of the mouth. It also consists of checking the lymph nodes for signs of inflammation or swelling, and the TMJ should also be checked for any impairment in function. So the vermilion border is the line between the lip and the normal skin, as shown here in this picture. The smile line extends outward from the corner of the mouth, and the commissure of the lip is where the vermilion border of the upper lip meets that of the lower lip. So these are the commissures, the corners of the lips. Here, a clinician examines the external tissues of the mandible and floor of the mouth of the patient. A clinician will also examine the cervical lymph nodes of a patient, and they're looking for signs of swelling, any abnormalities, any tenderness, and of course, any infection, which would be, which all of these would be signs of. Here, a professional examines the TMJ of the patient, and here we're looking for any noises, or any clicking or popping sounds, any tenderness, pain, or limited function of the opening of their jaw. Here, a clinician examines the floor of the mouth of the patient. Here, we're looking for any tenderness, any abnormalities, any lesions, and of course, any bony tori, which you will learn about in radiography, which are bony tori are overgrowths of bone tissue that we sometimes see on the floor of the mouth in the patient, as well as on their palate. Here we see a clinician examining the oral mucosa and frenum of a patient. The frenum attachment is that narrow band of tissue that connects the lips and the gum tissue. And we see that here is that vertical line. You want to make sure that the attachment isn't too large. And sometimes if it is, it can cause issues with speech. And sometimes that is removed or adjusted. Here, a clinician examines the tongue and the palate of the patient. And here we're looking for any palatal tori. So these are tori or bony growths that grow on the roof of the mouth, any geographical tongue, or any lesions associated with the tongue. Here we see a clinician examining the tongue of the patient. Here they'll usually grab the tip of the tongue with a piece of gauze, since the tongue is a little slippery, and they'll move it to the side and back and forth, up and down. And what we're looking for here is the color of the tongue. We're examining for any abnormalities there. The papillae, which are those hair-like fibers that we see all over the tongue. The coating of the tongue, is it glossy? Is it geographic? Is it discolored? And of course, any other abnormalities that we can see with the tongue. So here's a quick dental check. So by performing a visual examination of the internal oral structures, what are some observations the DA or the dentist may make? Well, this is the identification of lesions, any abscess teeth, and any color changes in the mucosa. So the diagnosis and treatment plan will consist of the dentist evaluating all the observations. So these include all the observations that he or she might have made, as well as any observations that you have reported to him or her. They will reach a conclusion and formulate a treatment plan. It's important to note that the treatment notes should be updated every time the patient visits the office. The treatment notes should consist of the current date, the tooth number, if we're talking about any specific tooth, the specific treatment that's administered, and then we also want to note if any anesthetic was administered and any reactions that the patient may have had to it. A recall or continued care appointment should be scheduled for the next patient's visit. These are usually done every 3 months, sometimes 6 months, or sometimes even 12 months between routine appointments. This is just to make sure that the patient has no new cavities or no new lesions, and also to check on the health of the periodontal structures, such as the bone and the gum tissue. So it is important to monitor vital signs and have a baseline from which to determine if there are any changes or abnormalities. Vital signs are the basic signs of life, and they include the body temperature, the pulse, the respiration rate, and the blood pressure. So here we see a professional checking the body temperature of a patient using a mouth thermometer. Body temperature is compared to normal body temperature, which is 98.6 degrees, and the higher or lower temperatures are looked into further. It is important to note that fluctuations in the body temperature are normal and will occur after exercising, a hot meal or beverage, or from emotions. If the patient's temperature is above normal, the patient is said to have fever. Antipyretics such as a cold pack, alcohol rub, or aspirin may be administered to lower the patient's temperature. If the body temperature is below normal, the patient may be hypothermic. This can be due to too much aspirin or prolonged exposure to cold. Here we see a professional checking the radial pulse of the patient. The pulse is assessed by palpation, which is a fancy word for feeling. It is felt as the beating sensations in an artery. The thumb should not be used to assess the pulse, as the thumb has its own pulse. There are 3 common sites for assessment of the pulse. The radial site is on the underside of the wrist, close to the thumb. The carotid site is in the neck, and the temporal site is felt near the eyebrow. For adults, a normal pulse or a normal radial pulse should be anywhere between 60 to 90 beats per minute. In children, a normal radial pulse will be anywhere from 90 to 120 beats per minute. Tachycardia means that there is an abnormally rapid resting pulse rate, while bradycardia means an abnormally slow resting pulse rate. Breathing includes the act of inhaling and exhaling. This is respiration. A normal respiration for adults will be 10 to 20 breaths per minute. In children, a normal respiration will be between 20 to 26 breaths per minute. It is best to assess the respiration when the patient is not aware of what you're doing. So you want to count the respirations after obtaining the pulse. The patient will still think you are taking a pulse while you count the respirations. Tachypnea or tachypnea, is the abnormal rapid resting respiratory rate. Bradypnea is abnormally slow resting respiratory rate. A blood pressure meter includes an inflatable cuff and a sphygmomanometer, or you can just say a manometer, which is connected by a tube. A blood pressure is the amount of labor the heart has to exert to pump blood throughout the body. The blood pressure is an important indicator of the health of the cardiovascular system. A patient may appear physically well, but may have a problem with the cardiovascular system that is undetected. This problem may be enough to induce a heart attack due to the stress and fear of dental procedures. So a normal blood pressure reading for adults should be somewhere around 120/80. Now the systolic number is the top number, or the 120. The diastolic number would be 80. A normal systolic should be something below 140, while a normal diastolic should be below 90. For children, a normal reading should be somewhere around 100/66. And for adolescents, a normal reading would be somewhere around 118/76. So going over the systolic and diastolic again, the systolic is the first sound heard when taking the blood pressure. It is the highest number in the reading, and it's caused by the heart contracting and forcing blood through the arteries. The diastolic reflects the heart muscle at rest. This is when the heart takes blood to be oxygenated before the next contraction. So this is the number recorded when you no longer hear the heartbeat through the stethoscope. When taking a patient's blood pressure, you want to extend their arm to the level of their heart. Make sure the arm is supported and relaxed, and then wrap and secure the cuff 1 to 2 inches above the antecubital space. So the antecubital space is the bend in the elbow, so it's on the other side of the elbow where we have that bend. So you want to wrap and secure the cuffs, or the blood pressure cuff, 1 to 2 inches above that. Next, you want to expel all the air from the cuff beforehand and inflate the cuff to somewhere between 160 to 180. Then you'll release about 2 to 4 millimeters of mercury per second, so very slowly. Here we see a professional locating a patient's brachial artery at the elbow. So just so you know, the area where this professional is pressing her 2 fingers against, that is known as the antecubital space. So just a quick dental check. Which pulse site is depicted here? Is it the radial pulse site, the carotid pulse site, or the temporal pulse site? Good. If you guessed the carotid, you are correct. All right, that's all I have for chapter 13. Please let me know if you have any questions. Thanks for listening.